The final stage in our treatment process is all about strengthening. Now, often many patients will come into the clinic and initially tell us that they've done a load of strengthening work, which is great, but the problem often is that it's just been done at the wrong time. In our opinion, the strength work should come at the end of the treatment process, when everything else is perfect, and it's the bulletproofing on top is the icing on the cake, because you will not be able to strengthen an area which your brain is trying to protect. You're going to be fighting against your own body, and that's often the trouble that people come into when they've been doing some conventional strength-based work. So by now, hopefully, the area in question is no longer hypersensitive. We know there's not going to be any damage, so there's no healing, there's no inflammation, and you've also started to integrate the movements back into your body so that you're familiar with that region. Now it's a simple case of, is it strong enough? Is it able to bear load and force? For example, with a low back, we need to make sure that you can walk, run, jog, jump, and take pressure and forces at all angles through that structure. Otherwise, everything else could be perfect, but if it's not quite up to that strength base, then it's not going to have the tolerance that we require. And it's when we miss this stage out, or when patients miss this stage out, that they often come back 6 months, a year down the line with the same problem, because they've not been able to create a good enough foundation. So when they go back into normal life and they start to do normal tasks, it's very easy to overburden that area again, and so the pain returns. So this is a really important stage, and can be spread, it depends on the patient, it can be done over a number of weeks and possibly even over a number of months. But at this point, treatment will generally be starting to space out as you're doing strength-based work and where required to do less, and the responsibility is on the patient to do the work. So hopefully that helps, gives you a better understanding of the whole treatment process, and if you have any questions, just ask.